can use deep scribe, step by step, to write your medical notes. Once my patient is roomed, I go in and I do what I normally do. I log into my EHR and look into my patient's chart. When I'm ready to begin my exam, I'll select the deep scribe button, select the room we're in, then click start. Deep scribe also gives me the option to start my exam right from my phone, tablet, or Apple Watch. Once I press start, deep scribe will light up to indicate that it's recording, and then I'll perform my exam as normal. What brings you in to see me?
Yeah, so I kind of noticed recently that the pain and chest and stomach has been getting worse.
Okay, how long has this been going on?
It's been on and off over the past few years, but I feel like it's gotten a lot worse recently.
Okay, all right. Where do you feel it? If you could point with a finger.
Yeah, so it's right here. It's it's right where my throat hits my stomach.
Right in the middle. Okay.
If I'm eating or drinking, right when it hits it, boom, and
Does it move, that pain, or radiate to your back, to your lower belly, anywhere else?
No, it's just in here.
Do you ever notice that it gives you any trouble breathing?
No, I don't have any trouble.
Do you ever notice that when you're exerting yourself or walking up a flight of stairs, it hurts more, or you get really winded, or even dizzy or lightheaded?
I get nausea occasionally, but that's about it.
Does it ever cause you to vomit?
No, I've never thrown up right now.
All right, and you said that this has been getting worse. What period of time are we talking about? How long has it been getting bad for? Is this weeks or months?
I feel in the past 4 weeks.
Do you mind if I take a listen to your heart and listen to your lungs and listen to your belly? Is that okay?
Yeah.
And don't take any big breaths. I'm just going to listen to your heart for a second. And it sounds perfectly normal. All right, well, I think what we should do is get you some other tests. I'd like to do a couple of lab tests.
Okay.
And I'd like to get you also signed up for an endoscopy and take a look in your stomach, if that's okay. So I'm going to send you a referral and get that started too. And I think we should also do a couple of lab tests, like I said. When my exam is over, I go into my EHR, I press stop, the light will go off, and that indicates that our recording is over. DeepScribe's algorithm will learn and adapt to how you practice, so that you can focus on what matters to you most, the patient. If there's a specific template that I want DeepScribe to use, or add something that was not said during the conversation, I can simply dictate it afterwards. Attach my normal physical exam template, and attach my GERD plan. I smelled cigarettes when he walked in the room, and he denied smoking in his social history, but I'm concerned with his possible odynophagia and his symptoms that it might represent some problem related to tobacco use. The notes typically take about 1 to 2 times the length of the exam to get back to me. Next time I open my patient's chart, the note is already completed, and all I have to do is sign it. And now I'm ready to see my next patient. Before, I would typically spend hours on my documentation. With DeepScribe, I'm able to restore the joy and care and bring balance back to my life.